I'm Margaret Brennan, and welcome to Facing Forward, a new podcast featuring in-depth interviews with the business leaders and policymakers shaping your world. There's a new administration in the White House, and President Biden will now have to figure out how to conquer the pandemic that continues to claim U.S. lives and choke the U.S. economy.
Let me be very clear. Things are going to continue to get worse before they get better. The death toll will likely top 500,000 next month. 400,000 Americans have died. That's more than have died in all of World War II. 400,000. This is a wartime undertaking.
A highly contagious new strain of the virus is complicating matters. And now there are other new virus mutations spreading around the world and possibly here in the U.S. Today we'll be talking to Francis deSouza, the CEO of Illumina. Through its work with the CDC, Illumina has helped to detect some of the very first cases of the UK variant, or B.1.1.7, reported here in the U.S. We're excited to have you on the podcast, Francis. How are you?
I am doing well. Thanks for having me, Margaret. I'm excited to be here.
Your company, Illumina, which is a public company, it's in the private sector, you conduct genomic sequencing, which is what scientists use to understand how infectious diseases spread and how they evolve. So for all of us who weren't science majors in college, how do you actually do that?
Sure. So what we do at Illumina is we provide the machines and the software that allows our customers to start with biological samples. So it could be, blood, saliva, and you take those biological samples, and our machine then reads sort of the genomic data in that sample. So it could be DNA, and in the case of this virus, it's RNA, and then we'll spit out on the other side a report with all the sequences in that biological sample. There's an awful lot that goes into the machines we build, a lot of molecular biology, a lot of chemistry, a lot of AI and computer processing to go from that biological sample to the report that we provide.
And you do this for all sorts of different viruses?
Yeah, we do it for any biological sample. And so, today we serve at Illumina about over 7,000 customers in 130 countries. And our customers include CDCs who are looking for pathogens and trying to identify emerging pathogens. And we were in Wuhan in December 2019, involved when the CDC team there was trying to identify the cause of what was then called this, pneumonia of unknown origin. And the first viral genome that was published on January 10th was actually published by a team at the Shanghai Public Health Clinic using our sequencers.
On COVID generally, how many different types of it exist in the world? Do we know?
Well, the virus is continually mutating. And so, a coronavirus typically mutates about 2 to 3 times a month. And so you can expect to see, many, many different types of virus with different mutations on them. Now, 2 to 3 times a month sounds like a lot. It's not as frequent as an influenza virus, for example, that mutates on average 10 times a month. And we follow those strains to try and identify not only just how the virus is mutating, which is important information to have because you're trying to figure out, does that mean our diagnostic tools will fail because the virus is mutated enough? Does that mean our vaccines will continue to be effective, our therapies? But you also want to track these mutations to try and identify how is this virus spreading? And that gives you insight that you can use to make policy decisions, for example. You could decide to shut down travel to a region if that's the place where your infections are coming from.
Mm-hmm. And by most accounts, the U.S. hasn't been doing a very good job of this. We've reported more deaths due to COVID than any country in the world. And according to one ranking, we're about 43rd in the world for genetic sequencing. If we had better sequencing, would that help us avoid further death?
I think more sequencing is important in terms of fighting the pandemic. And you're right. Although, in the US, we are a source of some of the innovations in sequencing, we have lagged behind over 40 countries, as you point out, in terms of just how much we're sequencing. So on average in the US right now, we are sequencing about 0.3% of the positive cases that we're seeing. Now, to get a good understanding of what's happening, you really need to be sequencing about 5% of the positive cases, as well as sampling the negative cases. Now, for comparison, countries like the UK that are leading are closer to sequencing about 10% of all positive cases.
Why aren't we doing this already?
One of the challenges here in the US is that there hasn't been a coordinating force. There hasn't been a central coordinating force across the nation. And so what's happening is you're seeing pockets of sequencing. And so, different labs, different health systems are making their own decisions about whether to sequence or not. And then some of them are uploading the data that they sequence into the public domain. Now that's different in other countries. In the UK, for example, because they have a national health system, there is a coordinated effort happening around sequencing. And so that's one of the things I think that we really need here. We need a national initiative around genomic surveillance. We need a coordinating central body around how to manage the flow of samples, and then also the funding associated with those labs actually sequencing, the samples they get.
So the Biden administration says it wants to do some of that by investing in both sequencing and surveillance. So how would that work? Does the CDC need to ask private companies like yours to help them do it?
There is hope, as you said. If you look at the Biden American Rescue Plan, in it, there are details around increasing funding for surveillance capacity at levels demanded by the crisis. And so there's definitely a thought that we need to increase funding for surveillance. That's one aspect of it, and also create a central group that will coordinate this. And then the central group will also help make sure that the samples from infected patients are getting to the right labs and that the data is being shared in the public domain.
If we did more sequencing, could we then do things like say, hey, Montana, shut down your restaurants, but Wyoming, you can stay and continue working. Thus, your economy can continue to grow. Is it that simple?
It's that straightforward. However, I'd say one of the most eye-opening moments here in the US of this pandemic was the realization early last spring that we had the virus circulating in the US for weeks and we didn't know it. And what that meant was we had no idea that there was, a pandemic starting and building. And it created the realization that we do need this genomics-based pathogen surveillance network. We need a network that will tell us if there is another coronavirus circulating, or if we're even under a bioterrorist attack, or if there's emerging antimicrobial resistance anywhere in the world, or if there's another zoonotic transmission, from an animal into the human population, that's spreading uncontrolled. And so there was this moment, this realization that we actually wouldn't even know if we were under attack. So instead of waiting weeks and months before we know we're under attack, it could be hours or days. And that makes a huge amount of difference in terms of being able to control, an outbreak before it becomes a pandemic. Also, if you are sequencing earlier and getting the genomic data of the pathogen earlier, that gives vaccine developers and therapy developers a head start. If you talk to companies like, Moderna or BioNTech, they'll tell you that it was the publication of the viral genome on January 10th, 2020, that really kicked them off in terms of developing the vaccine. And so the earlier you catch it, the earlier you get vaccines and therapies.
I want to ask you next about the mutations of the virus. Is it B117 or B117? What do you call the UK strain?
We call it B117.
You call it that. So that's the technical name for what you refer to as the strain that was first detected in the United Kingdom. It's highly contagious, but it's here in America now. The CDC says it's going to be the dominant strain by March. Exactly how much of the virus is here? Do we know?
Well, working with our partners like the CDC and Helix, we have now identified 74 cases of B117. That's up from 51 cases that were reported on the 6th of January. We've identified cases now in 7 states. So, Texas, Minnesota, Indiana, in addition to California, Florida, Pennsylvania, and Georgia. And it appears to be on the rise. So last week, B117 infections represented 0.17%, of the total infections we were seeing here in the US. And in a week, that's gone from 0.17 to 0.27. Now we know it's much more transmissible than some of the other strains we're seeing. So we fully expect that it'll start to become a more dominant strain in terms of the infections we're seeing here in the US.
So the UK found this mutation because they do sequencing. But correct me if I'm wrong, that doesn't mean that's where the virus actually came from, right?
That's exactly right. They found it because they have more sequencing and are just looking better than other places. It absolutely doesn't mean that it came from there necessarily.
Do we know where it came from? And is answering that question important to how you treat it?
At this point, we're not sure where it came from. And, over time, it will be important to sort of track, the spread of this virus. However, at this point, and especially in terms of treating it, it isn't essential to know where it came from. What is essential and is taking place is to understand, with every one of these new strains that we're seeing, whether it'll impact the efficacy of our tools to fight the pandemic, whether it'll affect the efficacy of our diagnostic tools and our vaccines and our therapies. And so you have the manufacturers of the tools and the vaccines and the therapies testing against these strains as they emerge and reporting their results. That's important.
And what we know to date is that the UK strain seems to be responsive to our current therapies, but it's this strain out of South Africa that there is early reporting on that indicates it may be resistant to certain treatments. That's B1351, right?
Yeah, B1351, exactly.
How much of it's here? Do we know?
It's early at this point. We have more data, as you said, on B117, and the data there is encouraging that our existing therapies hold up against B117 is the data we're seeing so far. We're getting very early data on 3151, and at this point, it's too early to call whether it escapes. Now, the vaccines are targeting, the spike protein on the virus, and it will take, a lot of mutations for the vaccines to fail, and so we'll have to see, what the results with B1351 are, and at some point there may emerge a strain that the vaccines aren't effective for. Now, the good news is, those vaccines can be updated pretty quickly, but then they'll have to go through the testing before they get released.
We spoke on Face the Nation to the incoming CDC director who emphasized she wants to focus on sequencing and surveillance. She mentioned the Brazilian strain. She mentioned a strain out of Nigeria. How worried should we be about those? What do we know about them?
We're going to continue to find new strains around the world. And the ones that will propagate are going to be the ones that are the most transmissible. And so, this will just continue to emerge. The important thing is to watch the results of the tests that the vaccine developers are doing and some of the therapy developers. And again, it's inevitable. And this may be, days, this could be weeks, this could be months from now or even years from now, but it's inevitable that there will be some strains that do require modifications of the vaccines that we have today. The vaccine developers know that. They understand what it would take to modify, their vaccines. And so we have to stay on top of it, though, because at this point, it's a foot race between how fast we're rolling out the virus and how fast the virus is mutating and spreading around the world.
The nominee to be the Treasury Secretary, Janet Yellen, testified this week that the Biden administration is going to try to raise corporate tax rates, but she said they're not going to return them to where they were. So right now they're at 21%, this flat rate. And before President Trump lowered them, they were in a range between 15% to an effective rate of as high as 39%. What would raising the rate above current levels do to your business?
It's a complicated question to answer without knowing all the puts and takes. So, for example, we want to see the specifics around not just, the headline number of what the corporate tax rate is on average, but also things like, how does the proposed, tax code work around things like research and development credit, revenue from outside the U.S., for example, or profit. So, there's a lot of details that we'd have to work through to really assess what the implications would be.
But the argument against it often is that would hurt your ability to hire, or any bite taken out of corporate profits comes at a cost ultimately somewhere. The other argument against it from the left is that corporations should pay their fair share. Do you see this as an argument that's going to dominate the next 4 years? Are you concerned about it?
I definitely think it will be a topic of conversation and debate, and as it should be, both in terms of what the fair rate should be, as well as what the uses of those funds are. How are we going to think about investing in America, whether it's on training or education? And so both in terms of sources and uses of funds, I think there should be sort of a very vigorous debate. Candidly, though, I think the more urgent conversations in the near term are going to be around the pandemic and how we get people through the pandemic safely and quickly. I think there are going to be conversations, too, around how we continue to drive American leadership in key areas globally of the global economy, but also in things like climate change, for example. And so I think there are going to be a lot of very important conversations that play out. And in the near term, I think the pandemic is probably going to be the single most important.
Yeah. On the pandemic front, the Treasury Secretary nominee also testified that having a paid leave and childcare policy in the U.S. would help the jobs crisis that women in particular have felt. Do you agree with that? And what are you doing at your own company on those policies?
Yeah, I think there's a lot more we could do to support, flexibility in the workplace, especially in times of need, specifically, in times of illness, or if families have a baby, for example. So, from our perspective as a company, for this pandemic, what we're doing is, about a third of our employees come into an Illumina workplace to build the machines, that we need to build to support customers that are, whether they're fighting the pandemic or in cancer centers. And so, the work we do is essential for those efforts. And so about a third of our employees do come in. We've done a lot in terms of retooling our workplaces, in terms of social distancing and just lots, cleaning the office, upgrading the ventilation, just a lot we've done in terms of ensuring that our workplaces are safe. And then for 2/3 of our employees, they work from home. And so, we have enabled them to be remote and be productive from home.
But should there be a government mandate on some of those specifics?
I think in some cases there should be, and again, that's going to be the debate that plays out on how much and for what and for how long. But I do think, we need to look harder at, supporting the people that work.
The Trump administration strongly suspected that patient zero came from a research lab in Wuhan. Maybe it was an accident. How important is it to find out the origin of this virus? You called it zoonotic, meaning it went from an animal to a human. What does pinning that down, exactly when it happened, prove or give us? And can you tell something like that from the work that you do?
I think over time, it will be important to understand, how this pandemic started. But at this point, it's not the priority. At this point, the priority has to be, understand how the virus is spreading, get the vaccines out as fast as possible, stay on top of strains as they emerge so that we know that our tools will continue to be effective, adjust our tools, if the virus continues to mutate. So Right now, my perspective is it's really all hands on deck to get us out of the pandemic. And then once we get out of the pandemic, I think there's very important research we can do to prepare us for the next one, including understanding the origins of this one. But that is not the priority right now. The priority right now is let's get through this pandemic.
Do you think we'll ever know?
I think I'm hopeful, but there's lots and lots of, the beautiful thing about RNA is, you can start to track histories. You can see mutations and you can go back and see, well, what came from what, and you start to build up these trees. So I'm hopeful.
Francis deSouza, thank you for sharing your insights and for your time today.
Thank you, Margaret.
Thank you for listening to the first episode of Facing Forward. New episodes are available every Friday. Join us each week as we make sense of our changing world together. I'm Margaret Brennan. You can also find me on your CBS network broadcast station Sunday mornings on Face the Nation, or on our digital network CBSN at 10:31 and 4 p.m. Sundays, or through our CBS All Access app. Facing Forward is produced by Face the Nation's Richard Escovedo and Kelsey Miklas. Be sure to subscribe to our podcast on your favorite platforms and leave us a review on Apple Podcasts.